process tenderness. Now I'm just going to pull back on the pinna. There's no tenderness when I pull the pinna. Okay, so that's the external ear. Now I'm going to move on to the hearing tests. Now you can time me because the head and neck exam should take you 15 minutes, no longer, because you're doing one eye and one ear and one nostril, the whole mouth. Now what I'd like you to do is to push the tragus in like this, and I'm going to say 2 words, and you need to tell me what they are. July 4th.
July 4th.
Perfect. So the voice test is within normal limits. Now let's do the hearing tests. Now I'd like you to raise your hand when you can no longer hear the vibration, and we already practiced that. Now first of all, I'm going to put the handle here, and then I'm going to hold the tongs upright. Okay? Okay.
That's gonna go on for a while.
Okay. Now, bone conduction was 11 seconds, air conduction was 27. So AC is greater than BC by a factor of certainly 2 to 1. So that was normal. Now, let me know if you can hear this better on one side than the other.
Not really.
So there's no lateralization, so the vapor is normal. Now we're ready for the ear test. Could you turn on the otoscope and then hand it to me, please?
But would we do that in both ears? Like what you just did on
When
the...
you practice, yes, not for the practicum.
Okay, but like in real life?
Yeah. Now the cord is kind of a problem. So when, and I don't want to hear, but I'm right-handed. Okay, what we're going to do is you always examine with the right hand the right ear. You use the left hand for the left ear. Now notice what I've done with the cord. I'm actually holding onto it so it doesn't snap my patient. Now I'm going to use my fingers as a brace in case he moves his head. Now he's an adult, so I'm going to pull the ear up and back. Now I see his canal beautifully. The angle of light is at 5. The malleus is at 2. The tympanic membrane is pearly gray. The canal has no defects, and the tympanic membrane is at 12. And I didn't kill you, did I?
No.
Okay, good. Now, left hand. Now here's another way to handle the cord. Some people like to use the elbow better because then their hand is unencumbered. Now, up and back. Now this is more interesting, much more interesting. So you have a large sheaf of yellowish wax occluding the entire ear canal. Except that I can see the, like we call the penumbra, just a little bit of your posterior tympanic membrane. But I mean, it's like this big fan of wax. So there you go.
Is that wax and they're gonna hurt him, or like?
That would be easily removed with a curette, no problem.
Okay.
A curette basically is long handle and it has a loop on it. And so basically, you catch the wax in the looped instrument and you remove it. But
Is that
it should-
something the nurse would do, or
Well,
that
actually-
he would do himself?
Nurses do this with special training. I want to show you something. See how the window moves back?
Uh-huh.
Now,
Oh.
a lot of times what I'll do is I'll do it right through this hole.
Oh.
Or
I see, I see.
what I'll do is I more or less visualize it and I determine how deep it is, and then very gently I'll insert the curette without visualization and get it out. Now the ophthalmoscope is another matter. So the first objective is, and just so you know, the ophthalmoscopes go on the left, and in order to have the light pass through them and not through the otoscope, you need to have it on the correct side. So the otoscope is on the right, ophthalmoscope on the left. Sorry. Now, this is the diopter. Now you can see that that's a 0, and it goes green, and it goes clear, and then to red. Now, I like people to know their starting numbers. So our text suggests start at 6. Now that brings the focus way close up. Now, as you move towards 0, it throws the focus away, which is fine. So, because you're really correcting for your problems and the person's problems. So you would have to take our glasses off, because I have, now a lot of you wear trifocals, and I've got 3 different areas of focus in these stupid glasses. So I mean, if I just look just like a millimeter up or down, everything becomes very goofy. Very goofy. So this is one thing that I suggest to practice with. What you do is you start on something that you can see, like the jacket pocket. Then focus on something a little bit farther away, like the jacket fold. So we've got close and far. So I'm going to start out at 6, and just to get to a lower number, I know that if I'm on this side, I'm going to have to move the diopter handle up. That's something you've got to practice with. So we'll go into 6, and I know that I've got to move this up. Now, since I'm looking at your left side, I'm going to have to shift this to my left. So here I am at 6, and I know which way to move. Okay, so I'm going to focus on this. Well, that's in perfect focus. Great. So now, without changing where I am physically, I'm going to change the focus. Now, the numbers are going down, and I'm focusing on this. So at -1, it's almost in focus. So the best focus for me is 0. So here I could go from 6 to 0, and I would be able to get the close focus and the distant focus. Some of you may have finer numbers, like a 3 to a 2, or say a 3 to a 1. Depends on you. So here I am with this left-handed approach. I'm going to go back to 6, and I'm going to remind myself, okay, I have to move my finger down to get the distant focus. So let's get the lights out. Now, can you just look at the board right there? The wall? Now, he's pretty tall for me. I think I'm going to look at this beautiful woman's nose. There you go. There you go. That way I can reach his eyes. Sorry. Now, I'm going to use my right hand to hold the eyelid up. And I'm going to come in, and I am going to come at an angle. I see the red reflex. Oh, that was fun. Now I'm angling around. Okay, all right. Now, his background is yellowish red, but it's an ivory. And I saw the cup and disc. The cup was bright yellow. The disc was more of an orange. And your artery to vein ratio was 2 to 3, with the arteries being smaller and the veins being larger. Now, if you can remember that, that's going to help you for your practicum, or rather your midterm exam. Because I'm pretty sure your lecturer will want you to know normal findings. Now, if I was going to do a right-sided exam, I've got this cord problem again. Now, what I can do is I can have him hold the cord, or what I could do is I could do this with the cord. Now, I'm going to have to start again at my close focus, but I have to move my finger the other way. So, okay, now. Now this way is even better. Oh, wow. Okay, done. Now, an ophthalmologist with all his special equipment can do a much better job than a primary care person can do, because that's their specialty. But you are going to see arteries and veins today. The first little challenge for you is to get that focus thing correct. So you can follow what the book does, or you can get your own numbers by starting here and just remembering which way you need to move the